welcome into my channel. I am Laser, and this is the third and final installment of the Surgery Diaries with moi. And for those of you who don't know, hello, I was born with a rare condition called Golden Heart Syndrome, or one of the many other names listed here. And it is a condition that affects anywhere between 1 in every 5,000 to roughly 1 in every 25,000 people on this earth. Big range, I know. But essentially, it affects people predominantly, most cases, on one side of the face. It's affected with jaw development. Some people have cleft lip or cleft palate, ear development, eye development. Sometimes there's spinal anomalies, and sometimes organs are also involved. But in rarer cases, people can also have both sides of the jaw development involved in their case of Golden Heart Syndrome. So, in my case specifically, hello, I had have one of the more moderate to severe cases, at least is what the doctors told my parents when I was born. And when I was born, I had pretty much a large portion of my left side of my jaw totally missing. And if it wasn't missing, it was very, very tiny, almost non-existent. And then on my right side, it was a little itty-bitty baby jaw that was also very, very small and not a normal size. And on my left side here, you can obviously see this was the mainly affected side with a large coloboma in my left eye that led to this effect in my pupil. And me not having a ear canal on this ear. And so now I have this handy dandy, trusty, awesome Baja hearing aid, that helps me hear. And also this ear was reconstructed, so I had very severe atresia and microtia on my left side. I could pop up pictures on here too. You saw nothing. All that being said, one of the major ways to treat Golden Heart Syndrome in patients is multiple surgeries. And I have had multiple surgeries, and so most of them were focused on getting my jaw advanced and into a better position to allow me to eat, breathe, and talk as normally as well as possible. So I didn't have to have any breathing assistance anymore or feeding assistance anymore, because I used to have a trach that would help me breathe and a gastronomy tube that was placed that would help me get food delivered directly into my stomach. So as you can see, I've come a very long way, and the last 2 jaw surgeries that I had were to help progress me to the point where I will be pretty much stable for my adult life, and have most of my teeth aligned, which is fantastic for the first time in my life ever. And have an easier time talking and breathing, because all of my jaw was brought all the way out here from all the way back here. So that was what those last 2 jaw surgeries were for. And now this is the final update regarding that. For those of you who didn't see the other 2 videos, if you're interested, they're on my channel, and you might not get some of the context in this video without having watched those other 2 videos, because this is related. It's the last part of the series of the Surgery Diaries. So, with all of that out of the way, we could jump into the final part of the Surgery Diaries, the 1-year retrospective. So, welcome in. Grab a cup of tea. It's going to be me talking for a while. Buckle up. The first order of business with this update is to let you guys know that they have finally cleared me for the sense of that they are now good to operate and start looking at doing the cosmetic updates that we were talking about in the last video, which is kind of a big step for me because I always have had this mindset growing up while looking different as I did, and I looked even more different than I do now, mind you. And growing up, I always had this mindset of I have to love myself the way I am because there wasn't anything about that I could change at that moment. And then anything that was like trying to change that basically meant that I was like confirmation to myself that I wasn't good enough the way I was. If that makes sense, it's kind of hard to explain, but I don't think it's a bad thing that I had the motto of loving myself the way I was, because genuinely there was not a way that I could change my situation back then, and obsessing over things that I would want to change would not have been any help and would have only made things worse for myself. And I learned to have a lot of strengths in myself that way, throughout living with that mindset, but also with that came for me a sense of like rigidity that I had to stay the same, and if I even looked at potentially wanting to accept that I won't like to change anything about the way I look, that I would be proving people right that I wasn't good enough the way I was already, and that I was more shallow of a person to even think about it. And so I limited that possibility in myself and kind of took the loving myself to a toxic place, if that makes sense. And it took a lot of work for me to kind of sit with myself and change that in myself and come to some conclusions that I was definitely never going to do beforehand. So the two things that I came to that I would like to change cosmetically are that once this surgery was done and they put this chin implant in, and then moved everything around and into the correct position to where now all my teeth align, which is fantastic. This little part of my chin here has a bit of a divot, and also over here, it doesn't show very well on camera unless if I do this. You can tell, you can tell that I have the line of where my head comes down, and then the line of where my jaw starts, and in between that line, there's quite a big divot. And so one of the cosmetic changes is going to be an implant that stretches below here, from here all the way to here, and it kind of comes into like a little hook shape here that flattens out this curve and fills this gap so it has a more smooth appearance. And then also on this side, the second change is that I just want to have some fat put in here to kind of lessen the dramatic drop off of fat that happens here. It's like goes from, having a smaller but normal-ish cheek to, whoa, where did you go? This is a valley. And so just to have even like just a more gradual change, I'm happy with, because I actually really like this little jaw I have here. I think it's really cute. I don't want to change that at all. So those are the two changes that I'm looking to have happen, and I'm waiting now for the insurance companies to approve these changes, which should not be an issue for me because of how clearly clearly involved with my medical condition it is, but they're having a difficult time for some reason. If you live in America, you'll understand. Anyways, basically I'm waiting for the insurance companies to improve this, and then while they go in and make these changes happen throughout 2 separate surgeries, in one of the surgeries, I'm also going to have a couple of my teeth that were hidden before because of how my jaw was shaped, brought out and started to be brought into my bite for the first time ever. I'm going to have more teeth than I've ever had, which is amazing. And essentially I'm going to have even more of a bite than I do now, which is fantastic and I'm really excited for. And that's going to be part of the final, also, functionality aspect for me when it comes to these surgeries, was because they needed to get my jaw into the correct position to have all my teeth line up properly first and everything, and then they can actually access these teeth that were stuck behind other parts of my mouth beforehand with how the jaw was positioned. And so they will be able to bring these teeth now into action and have them line up with my bite, which is so great. I'm really excited for that. And then after that heals and these teeth get put into the right position, I'm going to have a couple of teeth implants put in, so I have even more of a bite, which I don't think I can communicate how exciting this is for me, because before my 2 jaw surgeries that I had recently, I only had 1 tooth on the top of my mouth and 1 tooth on the bottom of my mouth that came together that were all the way up here and right here. So essentially, I would have to grind my food to a pulp over a very long period of time in order to actually eat. And I was always a very slow eater because of this. And so with this new change, I'm already experiencing my teeth lining up to a much better degree already, which was one of the main points of these last 2 major jaw surgeries. And then I'm going to be also adding more teeth to the mix, which is going to be fantastic. So I'm looking forward to that. There's more changes to come, but yeah, I'm excited. The other update was regarding the bite itself. Now, I was just saying that my teeth do align a lot better than they did before, which is true. But I do think I will probably have to have some kind of physical therapy for my jaw, which I'm not exactly sure how that will work, because I've never seen that happen before. But it's been making me think of the mewing trend that's been going around. Although I certainly, whether you believe in it or not, there's no way in hell it would have done anything for me with my case. But anyways, it's been making me think of the mewing trend, because I'm wondering if they're just gonna tell me to bring my tongue in posture up and then work out my jaw with an exercise ball. Anyways, I don't know exactly how it will work, but the reason I think I'm needing this is because I'm still having these rubber bands in my teeth I'm still having the elastics set up in my mouth that help realign the muscles and retrain them into the new correct position that they're supposed to be in. And in most cases, the muscles should have been trained by now to be now permanently in this correct position. But even though I am wearing the elastics as I should, 90% of the time, as soon as I let take the elastics off, I have to immediately, consciously tell my brain to jut my jaw forward in order to have the proper, bite. You can tell I'm doing it now. Now all my teeth are aligning. But since the elastics are not quite fully taking care of it as we thought they would, that's probably going to be the next step. which the idea of jaw physical therapy is still interesting to me. But hey, we'll see where that goes. And then, yeah, also, don't be coming into the comments saying, why are you not wearing the elastics right now? The only reason why I'm not wearing the elastics right now is so that you guys can actually understand me better. And you guys don't see all the elastics and hear it, like, squishing around in my mouth. So, yeah, I do wear them. It's not that I don't wear them, I think my jaw muscles got so used to being in the old position for so long that they're just not ready to give up and fully migrate into the proper position. I mean, look, this is the position that the rubber bands have my jaw go into, right? This is the position now. If I just don't do anything and don't actively the jaw forward, as they say. So, that's the only thing functionally that's left that didn't fully get taken care of by the jaw surgeries. The other thing that didn't fully get taken care of by the jaw surgeries was the nasal drainage issue / like snot getting stuck in my throat that I was having. Graphic, I know, forgive me. Prime example right there. But we were thinking that once I had more room in my sinus ways, that would die down and I would have an easier time. And that has not fully happened, so now we're investigating if something else is the cause of that, other than my jaw being smaller and therefore meaning I have, like, something else happening. I don't know. We'll see where that takes us to. But, yeah. That is pretty much your 1 year post-operation update. I myself am doing good. I'm excited to see what the future holds for me here. I'm just hoping, honestly, that my insurance company, approves this next surgery as soon as possible, because, Seattle Children's, the place that I go to now, is, like, seriously amazing, and even though I'll be able to keep my doctors, even if I have to move over to, the other hospital, the UW, I'd like to stay with Children's as long as possible, and I'm going to be aging out of their system soon. As soon as I turn 21. I've been with them for like 90% of my life. So, yeah. It would be a big change to kind of swap over to different hospitals, for this last little part of the major, like, face work stuff. So I'm hoping we can get this done before that official change happens. We got a little over 8 months now. So, no, less than 8 months. Okay. Well, anyways, that's the update. I really appreciate you guys watching, and if you guys have any questions or have any thoughts about this video, feel free to comment them in the comments below. I'll be sure to read everything, and, hey, if you have any questions that I haven't made a video on yet regarding the way I look or what my experiences have been in this life living with golden heart or autism or my gender identity, feel free to comment that, and you may get a whole new video as a response, because there's a lot of stuff I want to create on here, and I'm just getting started. So, yeah. Thank you again for watching, and I'll see you again next time hopefully a heck of a lot sooner than the last time I updated or uploaded a video on here. So, anyways, thanks again. Have a good day.